Our next guest is the only surgeon in Connecticut currently performing appendectomies and gallbladder surgery that he says leave no scars, no pain, and a fast recovery time. Dr. Kurt Roberts is a surgeon at the Yale University School of Medicine, and he's joined by his patient, Deirdre Gill. Dr. Roberts and Deirdre, welcome to you. Thank you for being here.
Thank you for having us.
This newer procedure, a little bit controversial. Not everyone is embracing it, but there are a lot of benefits. So tell us about this Scarless surgery. How does it work? And it works differently for women than men because the procedure is done differently on women.
Correct. So Scarless surgery, or what we call it as well, natural orifice surgery, is the latest frontier actually in minimal invasive surgery, where we can perform surgery through the vagina, for example, and inside and take the gallbladder or the appendix out. What are the advantages of doing that?
Yeah, what are the advantages?
The patients have basically no scars, obviously, on their abdomen, and they have almost no pain. It's really, truly amazing. That's what drew me into this field, is that there's almost no pain after the surgery. And the recovery after this type of surgery is 3 days, so be able to go back to work or to routine activities in 3 days versus 9 days.
So quicker recovery time. When was this concept first introduced? How long has it been around?
The ability to go through the vagina to take a look inside the belly is about 100 years old, but the modern area of this natural orifice surgery is about now over the last 5 years. Surgeons like myself and around the world are trying to introduce this concept.
And is that when you first started performing this surgery? When did you first start doing it?
I did a lot of work beforehand, obviously, and then once we were able to do the first surgery was about 2 years ago.
Why the controversy surrounding it, though?
There's a lot of controversies because the surgeons are generally conservative, and this patient safety is obviously paramount. So we needed to make first sure that the safety of the patient is always given, because it's so important, obviously, not to hurt our patients.
Right, and how many of these types of surgeries have you done?
Going purely through the vagina, I've done around 10, but going through, which is the advantage actually for men who are having the surgery done, going through the belly button alone without any additional incisions, so you can see the surgery, around 100.
Now, Deirdre, you had the procedure done this way. What was it like for you? Did you have any pain, scarring? What was the experience like?
I didn't really have any pain, and I have absolutely no scarring whatsoever, and I was basically back to my life within 2 or 3 days.
That quickly?
Yeah.
And what's interesting, we were talking before, you were saying that you have a friend of yours, a male, who had a procedure done, as you said, through the belly button.
Yep.
And he had some complications?
He got an infection.
And you were completely fine?
Yeah, I was completely fine. I got the operation on Friday morning, and by Sunday morning I was at the parade for the St. Patrick's Day Parade in New Haven on Sunday.
Were there any concerns in your head going into this beforehand? Were you a little hesitant about having the surgery done this way?
Not really, because I'm interested in medicine, so it was actually, I thought it would be exciting to be one of the first people that received this kind of operation at Yale.
I'm sure you had plenty of questions. I think one of the questions women might have in hearing about this type of surgery in terms of future childbearing, is that affected in any way?
Yeah, it's actually not affected, and that's actually the #1 question every woman has for me, or their spouses have for me, is future childbearing affected? No, it is not affected. Because what we do with the surgery, we go, yes, through the vagina, but we pass by the uterus and then go through the highest point in the vagina and then enter the abdomen, so future childbearing is not affected.
Okay, and in terms of the quality of a woman's sex life, is that affected?
It is also, I have to say, there's an inconvenience for the first 2 weeks, because these women with the surgery are not allowed to have any intercourse for the first 2 weeks. After 2 weeks, they'll be able to resume their activity, but we know that sexual desire, lubrication, the ability to orgasm is not changed, so there's no negative effects whatsoever.
Is this the type of procedure that more and more doctors are going to start doing, either across the country or even here in Connecticut?
It's around less than 10 surgeons around the country are doing this type of surgery, and patients just don't know about it. In Connecticut, there's around 5,000 gallbladder surgeries done every year, and women don't know about it. Therefore, they don't have this surgery.
But you, speaking on your own experience, it's something that, you know, it was pretty simple for you.
Yeah, well,
complication-free.
Yeah, I work full-time. I'm a student. I'm planning a wedding. Like, I have a lot of stuff going on in my life, and I didn't need to be sidelined and wind up having to not be able to finish the semester or miss out on a lot of time from work. I just come back from vacation. I didn't have that much time saved up for being able to be out like that, so it really worked out well.
Well, we appreciate you coming in and talking to us about it.
Thank
You as well. If you want more information, if you want to get in touch with Dr. Roberts, you can email him at kurt.roberts@yale.edu, or just come to our website, WTNH.com, click on the Connecticut Style link, and we'll have all of his contact information there. Dr. Roberts and Deirdre, thanks for coming in.